Members of the Physiological Society of Sri Lanka, the IT team and the staff of the Department of Physiology, University of Kelaniya, members of the quiz teams, students, friends, ladies and gentlemen. It is my pleasure and privilege to welcome you all to the 7th Intermedical Faculty Physiology Quiz for Professor Carlo Fonseka Challenge Trophy, conducted at the Faculty of Medicine, University of Kelaniya. It is a proud day for us, as this is the first time the Intermedical Faculty Physiology Quiz is being conducted as a virtual event. As you know, this event provides opportunities for Sri Lankan medical students to showcase their knowledge in physiology and also promote teamwork, leadership qualities, inter-university interactions, and formation of lifelong friendships. This quiz was first commenced in 2013 at the Faculty of Medicine, University of Sri Jayewardenepura. And it was guided by Professor Cheng Hee Ming of Malaysia, who was the quiz master at the event. The challenge trophy is named to honor Professor Carlo Fonseka, a giant among Sri Lankan physiologists. This year has brought extreme hardships to Sri Lanka, and conducting the Intermedical Faculty Physiology Quiz was a true challenge. However, the Physiological Society of Sri Lanka was determined to conduct it, as we were unable to do so in the past 2 years due to the coronavirus pandemic. The daunting task was readily taken over by the quiz committee, which was led by Professor Deepthi De Silva, whose commitment is unbelievable. She is supported by Dr. Padmini Dahanayaka as the secretary of the quiz committee. The IT team at the Faculty of Medicine, University of Kelaniya, has been truly amazing and have done a great job in making technical arrangements and developing innovative methods to conduct this virtual quiz. And they have been fully supported by the demonstrators and other staff members of the Department of Physiology, University of Kelaniya. Many physiologists from all over Sri Lanka have worked hard day and night to ensure the maintenance of the quality of the quiz, as well as the smooth conduct of the event. I thank all quiz committee members, the supervisors, judges, heads of departments, and especially Dr. Kushan Madagoda, Professor Diniti Fernando, and Professor Vajira Singha for their support. Dear students of the quiz teams, this is your day. This time, instead of meeting you face to face, we will meet you virtually. You must have worked extra hard amidst these difficult days to prepare for the quiz. We hope to have physiologists, students, friends, and families joining you to cheer you online and support you all along. So the time has come to begin the 7th Intermedical Faculty Physiology Quiz for Professor Carlo Fonseka Challenge Trophy. Wish you all a memorable day, and good luck to all the teams.
Good morning, everybody, and a very warm welcome to this, the 7th Intermedical Faculty Physiology Quiz, organized by the Physiological Society of Sri Lanka and hosted this year at the Medical Faculty, University of Kelaniya in Ragama. We meet virtually, but I hope that the standards of this quiz live up to the very high level that was attained by the previous quizzes that have gone before. The students here will be competing for the Professor Carlo Fonseka Challenge Trophy. Professor Carlo Fonseka was the founder dean and professor of physiology at the medical faculty here, and until his demise, the emeritus professor of physiology at Kelaniya. This year, we host 11 teams for this competition, and that includes 2 newcomers, the universities of Waiamba and the University of Sabaragamuwa. And of course, the fact that we are holding it as a virtual event is also unique. Organizing a virtual event of this nature is always a daunting task, made more difficult because we had not experienced anything like this before. But it was only made possible because of the help of this team of people. Firstly, from the Computer Center, Medical Faculty, University of Kelaniya, Ms. Pumi and Mr. Chamika, as well as Dr. Dilipa, who gave us constant support and advice on how to get over our problems that we were facing. And also from my own department, in the Department of Physiology at the Medical Faculty in Ragama, Ms. Taruka, and the three demonstrators, Dulanji, Pavani, and Ruani, who constantly worked hard to make it all possible. The development of the questions that were going to be included in the quiz was done by a large number of people, and they included representatives from all the medical faculties in Sri Lanka who were intending to compete in this quiz. The questions that they generated were improved on regular chats that we did on Zoom, and once they were ready, they were reviewed by a panel of senior judges who helped me select the questions that were finally included in the quiz. And the senior judges were Professor Vajraveera Singha from the University of Peradeniya, Professors Piyusha Athapattu and Dinitha Fernando from the University of Colombo, and Dr. Kushal Madhagoda from the Faculty of Medicine, University of Kelaniya. Lastly, the final proofreading was done by Professor Niranga Devanarayana and Dr. Lakmali Amarsiri to ensure that obvious mistakes were not missed. The quiz committee have designed a quiz to be conducted in 3 rounds. Round 1 will consist of a multiple choice question paper that every team member is expected to sit. There will be 30 single best response type multiple choice questions to be answered in 30 minutes. The 6 teams with the highest aggregate score will go through to round 2. Round 2 will consist of projected data interpretation similar to the OSPE that the students have faced already. There will be 20 OSPE questions to be answered in 20 minutes, and the team will be answering the questions together. The 3 highest scoring teams will then proceed to the final round, where they will face a rapid fire question, but this time it will be online, of course, and they will be allowed 3 minutes to answer as many questions as they can in that period of time. And the winner will hopefully be chosen at the end of the 3rd round. In any quiz, and particularly a virtual quiz, it is our duty as the organizers to ensure fairness in the competition. And we have set in place a system of scrutiny which I hope is adequate. We will be scrutinizing the teams as they compete. There's a local invigilator, a member of their own Department of Physiology, who's with the students. But in addition, we will have set up an online invigilation system as well. We have also tried to identify potential errors that could creep in an online quiz. And we have tried to address each and every one of those concerns. And I hope that we will be able to ensure that the quality of the marking is excellent. I have included the names of the judges who are going to be involved in this quiz. As you can see, they come from many different medical faculties and come with an incredibly large amount of experience, both with quizzes as well as teaching physiology. So I hope that with this very esteemed panel of judges, we will be able to have a good discussion and ensure that the best team wins. I wish all the competing teams the very, very best of luck. May the best team win. Now that the formalities are over, it is time to meet the most important people in this quiz, and that is the quiz teams. And now it's my great pleasure to introduce the quiz teams to you, all 11 of them. And this time you're going to hear them and see them
in their own words.
I am Officer Cadet MD and Lakshita from Faculty of Medicine, General Sir John Kothalawa Defence University. My goal is to serve my motherland as well as my people as a proud doctor.
Hello, I am Officer Cadet SMDS Gunasekara from Faculty of Medicine, General Sir John Kothalawa Defence University. My ambition is to serve my country as a good doctor.
Hello, I'm Officer Cadet NC Tennakon, third year medical student from General Sir John Kothalawa Defence University. My future goal is to become a good doctor and to be able to serve this nation to my fullest potential.
My name is Fatima Fadila Abdul Hamid from General Sir John Kothalawa Defence University, Faculty of Medicine. I hope to go into research one day.
Hello, I'm Natma Jayawardana, a medical student from General Sir John Kothalawa Defence University, and my goal is to be a good doctor.
Hi, my name is Vishan Gunawardana from Faculty of Medicine, University of Colombo. My passion is music and reading.
I'm Sarandula from Faculty of Medicine, Colombo. My passion is to travel.
I'm Manu Gunasekara from the Faculty of Medicine, University of Colombo, and my passion, I guess you can say it's reading.
My name is Pumudu Veerasekara and I'm from the Faculty of Medicine, University of Colombo. My passion lies in reading.
Hello, my name is Geet Gunasinghe. I am from Faculty of Medicine, University of Colombo. My passion is cricket.
Greetings everyone. I am Jahir Hassan. I am from Faculty of Healthcare Sciences, Eastern University of Sri Lanka. I am passionate about traveling. I would like to travel all over the world, explore new things and new individuals to learn something.
Hello all, I am Murina Dhalraj from Faculty of Healthcare Sciences, Eastern University, Sri Lanka. My passion is to be an instrumentalist. I love to learn different types of instruments and different music.
I am Goshian from Eastern University. I am passionate about playing video games.
Hey everyone, this is Shivanti Sivanathan from Faculty of Healthcare Sciences, Eastern University of Sri Lanka. My passion is to be a fashion icon.
I am Anuram Ravindra from Eastern University, Sri Lanka. I am passionate about playing cricket.
Hi, my name is Sasika Nipun Samarakodi. I am from Jaffna Medical Faculty and my hometown is Badulla.
Hello, I'm Aisha Nibal from the University of Jaffna. I'm really passionate about art and the healing power that it can bring to a soul.
Hi, I am Darashahani Ashokkumar. I am a third year medical student at University of Jaffna. I am passionate about learning new things and helping others, which make me feel content and relax myself.
Hello, this is Riji from Jaffna. I am passionate about being happy and making my surrounding happy. Thank you.
Hello guys, I am Sangavi, third year medical student from University of Jaffna. I am passionate about reading books, which helps me to gain more knowledge and gives me a level of fulfillment. Thank you.
Hi, I am Akhil Millar and we are from the Faculty of Medicine, University of Kelaniya. My passion lies in exploring the wilderness.
Hi, I'm Natmi Kiridana and I drive with good music can cheer up any of my bad days.
Hi, I'm Vidata Dhanasekara and I'm a big time fan of pop culture.
Hi, I'm Rantika Kurapu and I love reading Greek mythology.
Hi, I'm Kushan Madrathanam. I can turn anything into a yummy dish.
And we are Team Kelaniya.
Hello everyone, I'm Ganesham Nadrasa from the Faculty of Medicine, University of Peradeniya, and my motto in life is aspire to inspire before you expire. And this is Team Pera.
Hello everyone, I'm Rushdi Hassan from the Faculty of Medicine, University of Peradeniya, and my passion in life is to explore the unexplored.
Everyone, my name is Sandru Anumanavandupi and I am from Faculty of Medicine, University of Peradeniya, and my passion in life is dream big and live simple.
Hello everyone, I am Sandar Vijay Surya from Faculty of Medicine, University of Peradeniya. My life motto is don't be afraid to fail, be afraid not to try. And this is Team Pera.
Hello everybody, I am Physiological from the Faculty of Medicine, University of Peradeniya, and my passion in life is to become the best version of myself, and this is Team Pera.
I'm Rashmendra Sandanayaka from Rajarata University of Sri Lanka. Leading a healthy life is my passion.
I'm Vishani Shara from Rajarata University of Sri Lanka. Cooking and eating delicious food is my passion.
I'm Upekshika Silva from Rajarata University of Sri Lanka. I want to make my parents always happy.
I'm Ishara Lakshani from Rajarata University of Sri Lanka. Leading a balanced lifestyle is always my passion.
I am Madhu Pereira from Rajarata University of Sri Lanka. I like to lead a free and simple life.
Hi, I'm Sunil Kumar Singha from Faculty of Medicine, University of Ruhuna, and in the future I want to bring smiles on suffering faces.
I'm Kalinda Vikramasinghe from Faculty of Medicine, University of Ruhuna. My passion in life is to help people with what I learn.
I'm Sitara De Soisa from Faculty of Medicine, University of Ruhuna. My aspiration is to contribute, improving quality of life of the people, together with my capabilities and compassion.
Hi, I'm Mevan Indru from the Faculty of Medicine, University of Ruhuna. I aspire to be a true leader by contributing towards society using my skills and my talents.
I'm Siluni Samaranayaka from Faculty of Medicine, University of Ruhuna. My passion in life is to bring new hope to hopeless lives.
Hi guys, I'm Prasad Anuradha, a third year medical student from Faculty of Medicine, Salva University of Sri Lanka. I have a passion for playing flute.
I'm Metsari De Silva from the Faculty of Medicine, Sabaragamu University of Sri Lanka. I'm very passionate about traveling and being with nature.
I'm Pisani Veladilaka, a third-year medical student from Faculty of Medicine, Sabaragamu University, and I have a passion for music and languages.
Hi guys, I am Rashmi Viraj, third-year medical student from Faculty of Medicine, Sabaragamu University of Sri Lanka. I have a passion for video games.
My name is Ramina Vikramanayaka. I am a third-year medical student from the Faculty of Medicine, Sabaragamu University. I have a passion for pop culture and sports.
I'm Chamod Disanayaka from the Faculty of Medical Sciences, University of Sri Jayawardhanapura. My passion in life is exploring nature and trying out new things.
I'm Viduni Siravira from Faculty of Medical Sciences, University of Sri Jayawardhanapura. My passion in life is helping and taking care of animals.
I'm Karushi Diyanage from Faculty of Medical Sciences, University of Sri Jayawardhanapura. I'm passionate about being creative.
I'm Navin Hevage from the Faculty of Medical Sciences, University of Sri Jayawardhanapura. My passion in life is learning new skills.
I'm Vibhoti Silvapulle from Faculty of Medical Sciences, University of Sri Jayawardhanapura. I'm passionate about making new memories.
Hi everyone, I am Nisal Senadira. I am from the Faculty of Medicine, Vimba University of Sri Lanka. My passion in life is drawing. And by drawing, I mean not just traditional art, I mean digital art. In the old days, I used to draw a lot of traditional art using graphite pencils, watercolors, pastels, any medium I could get my hands on. But now when I came to the medical faculty, I found it very difficult to engage in traditional art because I couldn't bring my mediums everywhere. So then I resorted into digital art. Using my iPad and also my computer, I draw various pieces of digital art as often as I can. And in doing so, I don't just draw on traditional themes. I want to give the world something new, something extraordinary. So every day I push myself further and further to draw something new. Thank you.
Hi everyone, I'm Nitusha Fernando. I'm currently a medical student of Faculty of Medicine, Vimba University of Sri Lanka. My hometown is Chilao. Though I have been studying medicine for some years now, I haven't completely given up my interest in life. Some of them are reading, playing music instrument and spending my leisure time with family, friends and nature, and also engaging in some other extracurricular activities. Sometimes it's hard to manage these with my academic works, but I always think as a medical student, it is important to manage those two endings in life. Therefore, I always try to manage my time effectively and to enjoy my life here as a medical student. Thank you.
Hi, my name is Sandhu Ratnavira. I am from Faculty of Medicine, YM University of Sri Lanka. My hometown is Kadawatha. I am a huge cricket lover. In all days, I used to watch every single match. Now, though I have a busy schedule, I somehow managed to see some cricket matches. And I'm a music lover too. In my free time, I like to sing songs and I like to play my violin. Actually, it's a great cure to my stressful life. Thank you.
Hi everyone, I am Kelaniya. I am from Faculty of Medicine, YM University of Sri Lanka. My hometown is Anuradhapura. Though I am a medical student, I have lot of passions in my life. I love to travel with my friends. I hope to travel all over the world, and also I am a huge music lover. I listen to music in my free time for relax my mind. These fashions give my life happiness. Thank you.
Hi everyone. My name is Jitma Sitmini Disanayaka. I am from Faculty of Medicine, YM University of Sri Lanka. My hometown is Kuliyapitiya. As a medical student, I mainly focus to my academics. But I have a lot of passions in my life too. I love to travel all over the world, and also I like to do many adventurous activities. I try to spend my time with my family and with my friends. And also I listen to music in my free time and it supports me to relax my mind. As a game, I like to play chess. Thank you.
Thank you very much, teams. It was a pleasure to hear about yourselves. And at least, although you're not here physically, we have got to know you a little bit better. Now that the introductions have been done, let's get this quiz started. We will start with round 1. Hello again, everybody. This is Professor Deepthi De Silva. We are now ready to start round 1 of the quiz. The competing teams have already started this. So it's now your turn. I will be showing you the questions and at the end of each question, discussing the answer with you. Question 1. All these answers are correct regarding referred pain, but the one that best explains the mechanism is response D. Question 2. All these responses are causes of edema, but the raised BNP levels indicate cardiac failure in this patient. Therefore, a rise in the hydrostatic pressure at the venous end of the capillary is the most likely answer for this question. Question 3. The lysosomal hydrolytic enzymes need an acidic pH for their function. An active transport of hydrogen ions is needed to maintain this low pH inside the lysosome. Question 4. Of all the answers mentioned here, only the H or funny channel is involved in sinoatrial node depolarization, and its blockade will reduce the heart rate in this patient with tachycardia. Question 5. All of these mechanisms will cause a reduction in blood pressure, but only the beta receptor antagonist or beta blocker will cause bradycardia and peripheral vasoconstriction. Question 6. The PR interval in this ECG is progressively lengthening until a P wave is not followed by a QRS complex, leading to a dropped beat. This is Mobitz type 1 heart block, which is also called the Wencker-Bach phenomenon. Question 7. The most likely cause for the high pulse pressure in this patient, among those listed here, is aortic regurgitation. Question 8. The urine osmolality increases with water deprivation, indicating that the kidney is able to concentrate urine, excluding diabetes insipidus. Options B, D, and E do not fit these findings, and so by exclusion, the answer is A. Question 9. In the proximal tubule, as both water and sodium are reabsorbed equally, the filtrate remains isotonic. So line D indicates the osmolality. Inulin is freely filtered and neither reabsorbed nor secreted, so its concentration rises in the tubule. So line A indicates inulin. As nearly all the glucose is reabsorbed, its concentration reduces. So line E indicates the glucose concentration in the proximal tubule. Question 10. Acidification of the urine requires urinary buffers to prevent the limiting pH being reached rapidly. Increased secretion of ammonia is the main mechanism of enabling this. 11. The term purinergic is the giveaway here, as adenosine is a purine. Once you can work this out, picking the answer is easy. Question 12. This lesion damages the right spinothalamic and corticospinal tracts. There will be upper motor neuron signs expected in the right lower limb. Loss of pain and temperature will be expected on the contralateral side. As the dorsal columns are intact, there will be no loss of proprioception. Question 13. In organophosphate poisoning, acetylcholinesterase is irreversibly inhibited, causing excessive stimulation of both nicotinic and muscarinic acetylcholine receptors. Inhibition of acetylcholine activity is beneficial in the treatment of this problem. All the other conditions listed here have reduced acetylcholine actions. Question 14. This is a description of stress-induced analgesia, the mechanism of which is most likely to be related to activation of the descending analgesic system and probably involves the release of catecholamines. Question 15. This patient has motor aphasia, which is caused by a lesion of the Broca area of the frontal cortex. Question 16. The reduction in pulse volume with inspiration is called pulsus paradoxus. With the fall in intrathoracic pressure, right atrial filling increases, and as a result, left atrial compliance is reduced. This causes reduced left ventricular filling, stroke volume, and results in the reduced pulse volume. Question 17. Immediately after ascent to a high altitude, a person becomes hypoxic, resulting in compensatory hyperventilation and respiratory alkalosis. Point B in this graph represents the increased pH, hypocapnia, and low bicarbonate you would expect in this situation. Question 18. Hypocalcemia is associated with the Chostek sign, when the ipsilateral facial muscles contract after tapping the facial nerve at the angle of the jaw. Question 19. The low blood pressure with low sodium and hypoglycemia suggests an abnormality of the adrenal axis, while the presence of pigmentation suggests that the ACTH level is elevated. This supports reduced cortisol secretion as the most likely hormone deficiency in him. Question 20. Insulin secretion is associated with the release of an equimolar amount of C-peptide. Here, the raised insulin level with a low C-peptide suggests exogenous insulin to be the cause of this individual's hypoglycemia. Question 21. Due to loss of LH receptor function, a male fetus will have impaired fetal testicular secretion of testosterone and dihydrotestosterone, an abnormal or absent formation of the male internal and external genitalia, which causes a female phenotype. The loss of feedback inhibition by testosterone and dihydrotestosterone causes the rise in LH. Question 22. Of the many hormones that are increased in pregnancy, the site of this hormone's receptor restricts your choice to progesterone and estrogen. Of these two, estrogen requires the fetoplacental unit for its secretion. Question 23. In the mid trimester of pregnancy, the cardiac output rises due to increases in both heart rate and stroke volume. There is low resistance in the placental circulation, causing a reduction in the mean blood pressure. Question 24. The first hemoglobin that is formed in the embryo is hemoglobin GABA1, and it contains epsilon and zeta chains of globin, and these are indicated in lines D and E. Question 25. The low hemoglobin in association with the reduced haptoglobin and high reticulocyte count supports the diagnosis of intravascular hemolysis. Hemoglobin in plasma, which is not bound to haptoglobin, can be filtered in the glomeruli, causing hemoglobinuria. Question 26. In the stomach, prostaglandin reduces gastric acid secretion and increases mucus secretion. Inhibition of cyclooxygenase reduces prostaglandin formation and is the most likely cause for the increased acid and reduced mucus secretion given here. Question 27. There is only one correct answer here, and it is given as response B. Question 28. Once you work out that this is a fat-soluble vitamin, the choices you have are restricted to the last three options in this list. You are probably familiar with vitamin K and vitamin D, but may be less familiar with vitamin E. But you can work out that the description here does not fit typically for vitamin K or vitamin D action. And even if you did not know the answer, you may be able to work out that vitamin E is the correct answer. Question 29. The low pH suggests the diagnosis of acidosis, and it is associated with a high carbon dioxide level. And this is suggestive of respiratory acidosis. As he is also hypoxic, the diagnosis is type 2 respiratory failure with ventilatory failure as the most likely cause. Question 30. The combination of a prolonged APTT and bleeding time with normal platelet count suggests von Willebrand disease as the most likely cause of the bleeding in this patient. Now that we have finished discussing round 1 and the questions that have come up, it is my great pleasure to introduce Professor Niranga Devanarayana, Chair Professor of Physiology at the Faculty of Medicine, University of Kelaniya. Professor Devanarayana was the lead judge for round 1, and she and the team of judges have now decided on the marking scheme.
First round consisted of 30 single answer type questions, which you have seen few minutes ago. 11 teams participated in the quiz, and based on the marks, we are going to select 6 teams for the next round. I have here displayed the marks obtained by each team at the end of the quiz first round. This is the average mark obtained by 5 team members. Now I will announce the winners who are going into the round 2. Ranking number 1, obtaining 70 marks, University of Ruhuna. Number 2, University of Colombo, obtaining 68.67%. Number 3, University of Sri Jayawardhanapura, obtaining 65%. At number 4, University of Kelaniya and Rajaratha University of Sri Lanka, obtaining 57.33%. Number 6, going into the second round, is University of Peradeniya, obtaining 56.15%. Congratulations for all 6 teams going into the next round. And also, thank you very much for the teams who have participated in this quiz, make it a very lively and enjoyable event.
I would like to thank Professor Devanarayana and the team of judges who adjudicated on round 1. Thank you again for all the hard work. I would like to congratulate also the 6 teams who have made it through to round 2. Very well done, all of you, and I wish you the very best of luck for the rest of the competition. I would like to commiserate with the teams who could not get through to the second round. I hope that you found the experience of working for the quiz enjoyable and that participation in this quiz has made you realize how much physiology you have learned in the process. Now that the teams have started round 2, it's your turn to have a look at the questions and try to answer them. I will then discuss the answers and hopefully we can all agree on these. Question 1. To do this calculation, you first need to calculate the anatomical dead space volume, which is around 1 milliliter per pound of body weight. To convert this to kilograms, the weight is multiplied in kilograms by 2.2. Therefore, in a 50 kilogram person, the volume is 110 milliliters. You now take the dead space volume from the given tidal volume and then multiply with the respiratory rate to get the final alveolar ventilation. Some clinicians round this calculation up by multiplying the body weight by 2 rather than 2.2. So therefore, we will accept either calculation from you. Question 2. Oxygen cascade describes the flow of oxygen from atmospheric air to the mitochondria. The points that you should be able to identify easily are D to E, when the oxygen diffuses to the tissues and the partial pressure drops from the arterial to the tissue levels. This drop indicates high oxygen utilization and therefore is indicative of exercising muscles. The C to D line is the next easiest to work out, and that is the physiological shunt and diffusion inequalities that cause the arterial partial pressure of oxygen to be around 100 millimeters of mercury. A to B then is the atmospheric partial pressure of oxygen falling due to humidification. Question 3. This murmur occurs between the first and the second heart sounds, indicating a systolic murmur. As it is of a crescendo-decrescendo type, this is typical of an ejection systolic murmur. Normally, the second heart sound split is caused by the pulmonary valve closing after the aortic valve, and this is most obvious during inspiration. In this patient, an ejection systolic murmur is likely to be caused by either aortic or pulmonary stenosis. The reverse splitting of the second heart sound suggests that there is a delay in emptying of the left ventricle, causing delayed aortic closure, and this occurs in severe aortic stenosis. To calculate the stroke volume, you need to check the x-axis and note that in loop C, the stroke volume is around 150 milliliters. To get this number, you have to subtract the end diastolic volume of 300 milliliters from the end systolic volume of 150 milliliters. In both loop B and C, this is around 70 to 80 milliliters. The end systolic volume is also around 150 milliliters in loop C, while it is 50 milliliters in loop B and 40 milliliters in loop A. The end systolic pressure is 200 millimeters mercury in loop B, while it is around 120 millimeters mercury in loop A and 90 millimeters mercury in loop C. Question 5. Point A represents the V wave when atrial filling continues during isovolumetric relaxation of the ventricle. Atrial filling causes a rise in atrial pressure before AV valves open at the start of the filling phase of diastole. Point B represents the beginning of isovolumetric contraction, during which the bulging of the AV valves cause a rise in atrial pressure and the C wave. Six. In this ECG, the RR interval varies, but it is in sinus rhythm as a P wave occurs before every QRS complex. This is suggestive of a sinus arrhythmia. 7. Individual P has agglutination with anti-A antibodies as well as anti-D antibodies, making that individual blood group A positive. Individual Q does not agglutinate with anti-A, anti-B or anti-D antibodies, giving that individual a blood group of O negative. As a result, they cannot be the biological parents of individual R, who has blood group AB negative. Eight. Question 8. When red blood cells are immersed in a hypotonic solution, they undergo hemolysis, causing the pinkish discoloration of plasma. When suspended in 0.4 to 0.42% saline, there is 50% hemolysis and it is complete at 0.35% saline solutions. In this test, the red blood cells are more resistant to hemolysis than normal cells. This would suggest that the cells themselves are abnormal and is suggestive of, for example, sickle cell disease or thalassemia. Question 9. This lady's clinical presentation and thyroid function tests are suggestive of the diagnosis of thyrotoxicosis. This would be compatible with a high systolic, low diastolic blood pressure with an increased pulse pressure. Question 10. Substance X is likely to be adrenaline, which stimulates beta-2 receptors to cause vasodilatation. Substance Y is noradrenaline, which stimulates alpha-1 and alpha-2 receptors to mediate vasoconstriction, causing the rise in the diastolic blood pressure. Question 11. The diagnosis here is renal artery stenosis, which is the likely cause of hypertension observed in this patient. The renal artery stenosis and the reduced renal perfusion activates the renin-angiotensin-aldosterone axis. As the aldosterone effect increases, this results in increased reabsorption of sodium in the collecting duct, and this occurs in exchange for potassium or hydrogen ions. As a result, there is likely to be hypokalemia and alkalosis. Question 12. The blood results are normal, excluding diabetes mellitus, but there is glycosuria. This suggests a reduced renal threshold for glucose. One of the commonest reasons for this would be pregnancy. Question 13. These growth charts show a flattening of the height curve after around 6 years, but the head growth remains normal. The high growth hormone with low IGF-1 is typical of growth hormone resistance or a receptor defect. The lack of growth hormone action causes the low IGF-1, and the lack of feedback inhibition causes the rise in the growth hormone secretions. Question 14. This lady has bradycardia associated with a bitemporal hemianopia. This is suggestive of a pituitary tumor causing reduced TSH secretion and secondary hypothyroidism. Question 15. Secretin stimulates watery bicarbonate-rich pancreatic secretion that is relatively low in digestive enzymes. This means that bicarbonate is indicated by line A. There is a reciprocal reduction in chloride secretion compared with bicarbonate secretion in response to secretin, and this is indicated by line B. The amylase concentration is reduced due to a dilutional effect caused by the high flow rate of pancreatic secretions, and this is indicated by line C. There is no major effect on potassium secretion in response to secretin, and this is indicated by line D. Question 16. I'm afraid that this is a kind of question that requires prior knowledge of the proteins involved. You can then work out their locations and functions. Question 17. This karyogram is that of Turner syndrome of 45X, which is a condition associated with gonadal dysgenesis or streaky ovaries with no oocyte formation, ovulation, and the absence of estrogen and progesterone secretion. Because of this, the gonadotrophins FSH and LH from the anterior pituitary and GnRH from the hypothalamus will be increased. Question 18. The Weber test being heard better on the right indicates either a right-sided conductive deafness or a left-sided sensory neural deafness. The Rene positive is normal, which occurs when air conduction is better than bone conduction, and in this patient it is positive. The results are consistent with a partial left-sided sensory neural hearing loss, as it excludes conductive deafness in the right ear. Question 19. The highest osmolality of the nephron occurs at the tip of the loop of Henle. The highest reabsorptive capacity is in the proximal convoluted tubule, and the component of the juxtaglomerular apparatus is in the macula densa, which is located in the distal convoluted tubule. Question 20. This series of pictures indicate the inability of this individual to abduct the left eye. It is suggestive of a left lateral rectus palsy, which in turn is likely to be caused by a left sixth cranial nerve lesion or a lesion affecting the abducens nerve on the left side. Now that we have come to the end of the question discussion for round 2, we now can look forward to the adjudicator's decision regarding the second round and who will get through to round 3, the final round. So I would like to introduce you to Dr. Kushan Madhaguda, Senior Lecturer in the Department of Physiology, University of Kelaniya, who has been the lead judge of the group of judges adjudicating round 2. Over to you, Dr. Madhaguda.
Hello everybody, welcome back. So I have got the final results of round 2. We had 6 teams, team 1 to 6, and then I've got the final marks of the round 2. Team 1 scored 65, team 2 54.5, team 3 60 marks, team 4 scoring 51 marks, team 5 64.5, and then team 6 scoring 77 marks. Accordingly, we have selected first 3 teams going to the next round, and the teams are University of Sri Javadanapura scoring 77 marks, and then University of Colombo scoring 65 marks, and then University of Ruhuna scoring 64.5 marks.
Thank you, Dr. Madhaguda, and all the judges of round 2 for all the hard work they have done to get the results out quickly, but also, of course, very accurately. I would like to congratulate the 3 teams who have made it to the finals. I'm sure you and your supporters are delighted, and now we'll be rooting very, very hard to see whether you can make it through to become the eventual winners of the Challenge Trophy. For the 3 teams who are unfortunate in not being able to get through to the final, I commiserate with you, but do also congratulate you for all the hard work that you have done to get this far in the quiz. Thank you for participating, and I hope to see you next year. We are now going to start round 3. The 3 teams will be given the same questions, but they will be answering them one team after the other. It's a team effort, and the team will have a strategy to how to answer these questions as quickly and as accurately as they can. At the end of all 3 teams' performance, the adjudicators will start their decision-making process. And in that time, I will be discussing the questions as well as the answers to these questions for round 3. now we're going to discuss round 3. These are the questions, and this is the way the students in the quiz teams were presented the questions. They were like one question sheet had 10 questions. So they could answer as many or as few as they could and then move on to the next question sheet. So let's see how you get on. I'll project this for a little while and then I'll give you the answers. Right. Okay. So the nanometer is 1 billionth of a meter. So I think most of the teams got that answer, which is, I'm very impressed because nano-sized particles are becoming more and more important in medicine now. And nanotechnology is becoming a reality for all of us. And as doctors, you may either be involved in therapeutic advances because of nanoparticles, and you may see people who in the future we may realize that nanoparticles may not be that safe for us because they're able to penetrate membranes really easily because of their size. Okay, so 1 billionth of a meter. Now the timing of a murmur, of course, is either systolic or diastolic, or it can go through both systole and diastole. And I think at least 2 of the teams did not get this correct because the murmur caused by a patent ductus arteriosus, a PDA, occurs during both systole and diastole. It's also often called a machinery murmur. It goes on and on. It's a rough sound and it doesn't stop. So there's no difference between the first and the second heart sound. They all merge together. A machinery murmur. I think all the teams got this one. It's well-known phrase, but it's good that you managed to remember. Small respiration, the fast and deep respiration that occurs in metabolic acidosis. Right. The hormone that regulates the sleep-wake cycle, I think many of you remembered, has been melatonin. Right. You may not see the word telaki. It's been hidden the answer here for me. I hope you can see it. Telaki is the very beginning of adolescent breast development in a girl. I think everybody knew question 6, but I'll let you also have a look at these questions and see how well you get on. Of course, I'm giving you heaps of time. The poor team members did not get that luxury. They had to type as fast as they could, and they had to depend on like their reflexes virtually to remember things. We have very little thinking involved. And in a way, it is kind of representative of what happens in real life when you're a doctor. You have to be really quick in some decision making. But sometimes you need to sit back and think. So I think these quizzes are, in fact, funnily enough, preparation for your life as a doctor. To know when you're confident enough to answer a question and to keep going on. And then there are times when you have to sit back and discuss as a team. Okay? So some things everybody remembers, and all of you, the team members, could have answered this, but the person who I suppose was typing would know it and answered it first. So the vitamin K dependent coagulation factors are factors 2, 7, 9, and 10. So remember that if you're writing it correctly, you have to write it like this. Right. Number 7 is one of these funny questions, whether I suppose it is someone who's studying physiology or teaching physiology who would know the answer to number 7. And I suspect that you went to the hospital and asked most doctors, they would probably not remember it. Okay, so there are some things that you need to know at one particular period of your life. And this answer is one of them. Okay, the PAH, you would have accepted PAH as an answer because the proper answer is so long, para-aminohippuric acid. So if you, I don't know whether many people, many of the teams who in the final answered that, but if you remembered PAH, that's good for you. But the fact, as I said, is that unless you are specialized in that field, most general doctors probably would not bother remembering something like that. But at this stage in your career, it's good to know. Like this word, it's too late in the afternoon. I'm really stressed, so I'm not going to even attempt to pronounce it. I'll get it all wrong. And this is a word that's in Ganong, and it means the inability to recognize faces. So I think it is prosopagnosia. Prosopagnosia is the inability to recognize faces. Now, that's a funny word. And the reason I can't say it as a doctor who's kind of worked as a doctor for some years is that, again, it's not this. I suppose it's such a mouthful that most people don't use it. It's much easier to say they can't recognize faces than to remember this word. Okay, so it's one of these kind of tricky questions that you would get in a quiz. In real life, if you didn't know it, it's probably not the end of the world. But this question 9 is a funny question because it's one of these kind of physical theoretical questions that you might think, who cares, who knows, who doesn't matter. But in fact, you will find that in many fields of medicine, in practicing doctors, we remember the law of Laplace because it has so many important practical applications in medicine and surgery and obstetrics and whatever. Okay. So the law of Laplace is an important physical law that we teach you as medical undergraduates because it's so important for your future work as doctors as well. Right. Now the dynes per centimeter is an old unit, but it is a unit that's still being used. And it is a measurement of in the alveoli of the alveolar surface tension. Some more questions for you. Right. Question 11, I think you probably do remember. And that is the cardiac index. Okay, I think the answer is not coming up for you. So it's one of these things that I suppose you would know anyway. Question 12, I think, is probably very familiar to anyone who's studied respiratory physiology. And that's why we put it in the quiz. Normally, you put a graph like this to ask people to think and read and understand, and then explain it. We put it in because we think that it is one of these graphs that everybody will remember. At least good students should be able to remember well, and they should very quickly identify that X represents the closing volume. Some more questions for you. Right. Can I just check, are the teams who participated in the quiz, are you able to hear me and are you looking at the questions as well? I can see them looking at the screen very carefully. Not sure whether they are looking at this or just looking at something else. Right. Okay. So question number 13 is one of these questions that you either remember or you don't remember, because you probably remember that there are 2 of these channels, and I think many of the teams probably named the wrong channel. So here it is a dihydropyridine receptor that mediates the release of calcium from the sarcolemma itself. Okay, so it's a dihydropyridine channel that functions like this. The RYR channel is not involved at this stage. It is involved in the release of calcium from within the sarcoplasmic reticulum. I think everybody probably remembers number 14. Glutamate is the most abundant excitatory neurotransmitter in the brain. Right. I'm surprised that some people that they left this question unanswered, question number 15. And that is the very famous enzyme 5-alpha reductase. And you remember that 5-alpha reductase converts testosterone to dihydrotestosterone. And if you inhibit that enzyme, it is used as treatment in prostatic hyperplasia. And because therefore it's very important therapeutically, so we thought it would be useful as an enzyme that you will probably meet again after you finished your physiology course. Right. Now, number 16, again, is one of these theoretical things because nowadays we don't do it manually. Most hospitals, certainly in the future, when you're doctors, we will probably, more and more of us will do the automated calculation of the blood indices. But of course, it's good to know the theory. And what we use to measure the MCV, the mean corpuscular volume, is the hematocrit and the red cell count. And I think some of you got it right. I don't think anybody attempted this question. Question number 17. And it may be that you are tired by this time. The isohedric principle is described here. It's one of these things, either you know it or you don't. I suppose you can't work it out for yourself. So it's one of these facts rather than things you can work out. It is a good theoretical concept, a clinical practice. I suppose you know it, but you may not know it as this principle. Okay, so let's see. I hope some of the people who are watching have also got some of these answers correct. So MMCs begin in the stomach. Okay? And the receptor that memantine inhibits is the NMDA receptor. The answer I put for the question number 20, I have put GLUT1, and GLUT1 is one of the important ones, but I know one of the teams who answered put GLUT3, and that is also correct. So we will accept GLUT3 as an answer as well. So well done, you guys, for getting one on us, because we should have thought of GLUT3 as well to include in our answer. Hormones secreted by the heart that increase sodium excretion, of course, brain natriuretic peptide and atrial natriuretic peptide, which I think you got. Right. This is the forced vital capacity, the maximum volume of air forcibly exhaled following a maximal inspiratory effort. So when you did the measurements or spirometry measurements in your lab work in your respiration practical, you probably asked each other to do that. So that is the forced vital capacity, and of course a very, very common measurement in clinical practice. Whether you're a respiratory physician or not, you will be aware and use this test. So it's something it's worth remembering. So what neuroendocrine cell secretes histamine in the stomach? It is, of course, the enterochromaffin-like cells. Now, this is a trick question in that when you see that white nipple discharge, you know it's galactorrhea, and you say, okay, there's too much prolactin. But the question that is asked is what is reduced, not increased. Okay? And of course, what is reduced, and it's a hypothalamic hormone, is of course dopamine. Dopamine that inhibits prolactin secretion in all males normally and non-pregnant females. The most potent estrogen is estradiol. You remember there are many different types of estrogens, but estradiol is the most potent. And what we mean by potent, of course, is that it has the greatest affinity to its receptor and therefore exerts the greatest amount of effect. And the protein that binds thyroxine, the biggest amount of thyroxine binding is in fact by albumin, just because there's heaps of albumin rather than thyroid binding globulin. Okay. I think probably everybody who got this far would remember this. And I'm going to finish
at this slide because I don't think anyone went beyond this. So which cells in the distal tibial secrete hydrogen ions? Is the intercalated cells. Slow waves in the smooth muscle are the interstitial cells of Kagel. Right. So that's as much as I'm going to discuss with you. So I hope you have a rough idea of what has gone and what the answers, how we are going to mark. And I hope you enjoyed yourselves watching this. So now I'm going to give you a break and I'll hand you back to the channel until the judges have come up with the marks for deciding who's going to be the winner of this year's quiz.
මන්ද කියාලා කිසිවක් නොදනිමි දියදහරක් මෙන් ඇදමින් ආවෙමි කොයිද කියාවත් කිසිවක් නොදනිමි මරු කතරක සුළඟක් මෙන් පිටවෙමි කොයිදයි කියාවත් නොදැන දිය ධාරාවක් වාගේ ඉබේම මම මේ ලෝකෙට ආවා මේ ලෝකෙන් කොහෙටද යන්නේ කියාවත් නොදැන කාන්තාරයක මරු සුළඟක් මෙන් මම මෙයින් පිටවී යනවා එහෙනම් කුමක් සඳහාද අපි මේ ලෝකයට ඉන්නේ? ලෝකයට ඇවිත් තියෙන්නේ. මොකක්ද මේ ජීවිතයේ අර්ථය? කාන්තාවක් ඉන්නවා මේ කොරිඩෝවේ ක්‍රච් එකක් මෙහෙම කිහිල්ලේ ගාගෙන මම යනකොට එයා මන් දිහාට හොඳට උවමනාවෙන් බැලුවා. ඉතින් මමත් ටිකක් කිట్లాම පොඩ්ඩක් අඳුරනවා වගේ මේ මහත්තයා මේ ඔයා ටීවී එකේ එනවාද කියලා. මං ගාව ඉඳලා හිටලා වැටෙනවා ටීවී එකෙත් කියලා. ඉතින් මාත් මොනවා හරි එයාටත් කතා කරන්න ඕනනේ මේ ක්‍රච් එකකින් ඉන්න. මොකද ඔයා මොකද්ද ප්‍රශ්නේ? නෑ මේ මහත්මයෝ මම මේ දැන් ડોක්ටර්ව චැලෙන්ජ් කරලා එයාව ගිහින් බැලුවා. එතකොට එයා මට කිව්වා මට හાર્ඩ් ට්‍රබල් තියෙනවායි කියලා. ඊට පස්සේ මට ඉස්පිරිතාලට ඇවිත් කියලා සීසන් කරන්න ඕනයි කිව්වා. ඊයේ මාව ටිකක් ලැස්සලා වැටුණා. ඒක නිසා දැන් මං ක්ලච් එකෙන් යනවා. දැන් බලන්න මහජරතුමනි අතිශයින්ම සක්සුදක්සේ පැහැදිලි එතුමිය මට කියන්න කිව්වේ මේ ඉතින් අර හතර වැරදුනාට මොකද? I tend to see everything in terms of what I have read in books. Books, after all, embody the collective experience of the human race. And reading books gives you access to the best that has been thought and said in the world. එතකොට මේ අසාධාරණ විරුද්ධව කරන මේ සටන කෙලවර වෙන්නේ නැහැ ජයග්‍රහණයෙන් මෙහා. ඒ සටන දිගටම යනවා. ඒ සටන තිබෙන තාක් කල් මමත් ඒ දරුවන් සමගයි. මේ සටන තමයි සහෝදර සහෝදරියනි මට සුපුරුදු සමාජ භාෂාවෙන් කියනවා නම් මගේ අන්තිම සටන.
තනතුර බාරගත්තේ නැත්නම් රජයේ වෛද්‍ය නිලධාරීන්ගේ සංගමයේ වර්ජනයකට යනවා. ඒක නම් කරන්න එපාම කියලායි මම දන්න සිංහලෙන් කිව්වේ. දැනොත් වැඳලා අනුරුද්ධට ගියා. වැඳලා ආරතට ගියා. අනේ ඒක නම් කෙරුවොත් ඊට වඩා හොඳයි යන්න ඉස්සෙල්ලා මගේ බෙල්ල කපලා දාලා යන්න.
වෛද්‍ය විද්‍යාලයේදී පළමුවෙනි වාර විභාගයේදී මට තමයි කායික විද්‍යා විෂයට වැඩිම ලකුණු ලැබුණේ. ඒ ලකුණු ලයිස්තුව දැන්වීම් පුවරුවේ දමා තිබුණා. දවසක් ගැහැණු ළමයි දෙන්නෙක් ඒ ලකුණු ලයිස්තුව ගැන කතා කරනවා මට අහම්බෙන්න වුණා. ඒ අය දැන සිටියේ නෑ මට ඒ අය කියන දේ ඇහෙනවා කියලා. ඒක ගැහැණු ළමයෙක් කිව්වා කාලෝ ෆොන්සේකට තමයි වැඩිම ලකුණු ලැබිලා තියෙන්නේ. එයා හරි දක්ෂයෙක් වාගේ නේද? එතකොට අනිත් ළමයා කිව්වා දක්ෂයෙක් වෙන්න පුළුවන් ඒ කිසි ලස්සනක් නැහැනේ. එතකොට පළවෙනි ළමයා කිව්වා ඔව් ඒක නම් ඇත්ත තමයි කියලා.
ඇත්තටම වෛද්‍ය විද්‍යාව ගැන මගේ මිත්‍ර හරිස්චන්ද්‍ර මහත්මයා පිළිගන්නවා ඇති. අපි කියනවා නිකමට වාගේ වැඩි ප්‍රසිද්ධිය කියන්නේ නැහැ. ඕනෑම අවස්ථාවකදී දොස්තරලා දන්න කාරණා වලින් 50% වැරදි. අවාසනාවකට කොයි 50%ද කියලා දන්නේ නැහැ. The really basic problem to address is very simple. What is the most reliable method humankind has for gaining knowledge about the world we live in? What is the most reliable method humankind has at this point in time to gain knowledge about the world? My answer is, it is the method of modern science, and this is very simple. It consists of careful observation, formulating an explanation, a causal explanation to account for the observations, and then testing to see whether the explanation is valid or not. Just 3 steps: observing, logical reasoning, and testing empirically. Now, this was the approach that I used to deal with the problem of fire. Okay, this is the approach that has enabled humankind to put a man on the moon, to crack the genetic code, to clone sheep, to transplant hearts, to invent television on which you and I are now performing. හෙළ කවි ආදෝ චන්ද්‍රසේකර ලියපු කවියක් මගේ මතකයේ තිබෙනවා. ආදෝ චන්ද්‍රසේකර මෙහෙම කියනවා: යමකුගේ නම වහරේදී කෙටිවන තරමට එහි හරබර බව වැඩි වැඩියෙන් දැනේ නම් හේ ඇත්තටම නම ඉතුරු කැර යන්නකි.
උගතිමි විද්‍යාව නැවිය නොහැකිය, නැසිය නොහැකිය. උගතිමි බුදුදහම නැත්තෙමි මම ඇත්තේ පංචස්කන්ධයකි. එබැවින් මතු දිනක සොහොනක ඔබමා නොසොයන්න. දූවිල්ලේ සුළඟී වැස්සේ තුරුලතාදියේ සතුන්ගේ සිරුරේ මා විසිරී පැතිරී ඇත. එයයි යලි ඉපදීම.
Members of the Physiological Society of Sri Lanka, students, ladies and gentlemen. At the conclusion of the 7th Intermedical Faculty Physiology Quiz, organized by the Physiological Society of Sri Lanka, I have the honor of conveying the gratitude of the quiz committee to those present at this virtual gathering for attending this quiz. As the secretary of the quiz committee of the PSSL, I'm delighted that we were able to hold the 7th Intermedical Faculty Physiology Quiz at the Faculty of Medicine, University of Kelaniya this year very successfully. It is the first time we hosted the quiz as a virtual event. This year, the PSSL quiz gave a great opportunity for all of us to gain a different first-hand experience of a virtual quiz, marked also by the presence of largest number of teams representing 11 faculties of medicine in this country. Preparation for any quiz is not an easy task, which is made more difficult given the current situation in the country. Formulating suitable questions and ensuring maximum fairness takes a lot of commitment from the academic staff members, especially those in the quiz committee. This year, the quiz committee was headed by a very dedicated senior academic Professor Deepthi De Silva, Faculty of Medicine, University of Kelaniya. I would like to take this opportunity to thank Professor Deepthi De Silva and our quiz team for their commitment and hard work to make this quiz a success. I also extend my sincere gratitude to senior academics, Dr. Kushan Madagoda, Professor Vajraveera Singha, Professor Diniti Fernando, Professor Niranga Devanarayana, and Dr. Lakmali Amaraseri for their invaluable contribution made to enhance the quality of the quiz. Then, I greatly appreciate the immense support extended by Professor Piyusha Attapato, the President PSSL, and the Executive Committee of PSSL to organize this event successfully. An event of this nature cannot be organized without the IT team of the Faculty of Medicine, University of Kelaniya, namely Dr. Dilip Ediriveera, the head, Charmika, Pumi, Dilini, and Lakmal. I would like to thank them all for their untiring efforts to make this a memorable event. I would be failing in my duty if I do not acknowledge the efforts of our young and energetic demonstrators, Dulanji, Pavani, Ruani, and Sandulika, and the management assistant, Taruka of the Department of Physiology, Faculty of Medicine, University of Kelaniya, for all the untiring and countless efforts they undertook to make this event a memorable reality. I would also like to thank all the judges of the quiz, supervisors of the quiz teams of each faculties, heads of the departments of physiology, and all the academic staff members of departments of physiology participated in this quiz for their continuous support for organizing this event. It is also essential that I thank the IT centers of the participating faculties, without whose technical support this event would not have been possible. We owe a very special thank you to Vice Chancellor, University of Kelaniya, Senior Professor Nilanthi De Silva, and Dean, Faculty of Medicine, University of Kelaniya, Senior Professor Janaki Heva Vicente, for their invaluable assistance extended to make this event a success. Also, I would like to express my special thanks to Mr. Pushpa Kumara, Lakpom Printers, for printing our certificates. I'm also thankful to the excellent services rendered by Mr. Sanjeeva Fernando, Business Unit Head, Kalbe International, Sri Lanka, for supplying food and refreshments for the participating staff. I'm also grateful to those working in the cleaning and security services, Faculty of Medicine, University of Kelaniya, for their hard work. Last but not the least, I'm thankful to the students of the cheering squads of the faculties who extended tremendous support to their fellow students in the quiz teams and encouraged them. I would like to conclude by wishing the very best to all the teams participated and the winners of today's quiz. Thank you and have a good day. The winners, it is the University of Colombo who have won the trophy this year. Well done, Colombo. Can we have a look at your faces, please? It's lovely to see you guys. Well done, University of Ruhuna. You're the first runner-up. And well done, the University of Sri Jayawardhanapura, who are the second runners-up. It's always tough to get through to this part of the competition. You're equally matched. And sometimes it happens to be the luck of the draw. And, you know, some days you just are a little bit luckier than others. So well done, University of Ruhuna. You did a valiant job and you must be very proud of yourselves. Well done. I hope you're very proud and you're very happy. Now I see the University of Colombo. Well done, guys. You're an all-boy team and you did it. This is your trophy and you have won. And behind me, you see Prof. Diniti and Prof. Piyusha, who are beaming. You can see, madam, the two madams.
And they are getting that other one as well.
Yes. And you're going to get another one. This one is going to be with you or in your faculty forever. So in 100 years' time, unless it decomposes, it will be there to remind of the victory of the Colombo
that was
team.
last year's one. Okay.
So well done, Colombo. And sorry for you to say bye to you guys, but well done. So we can stop now and you can celebrate together. Okay? Bye, guys.
Thank you, madam.
Thank you, madam.